Hi everyone. Having discussed the herpes viridae family, we are on our journey to do the rest of the DNA viruses. So now I'm going to pick up the other set of 4 DNA viruses. I'm not going to discuss bacteriophage because I assume that we all have studied bacteriophage in a lot of detail while we were doing which aspect of bacterial genetics. Bacteriophage was very important for transduction, isn't it? So we've read everything about bacteriophage over there. That leaves us with the APPP. And that is what we are going to start with. So first one, I'll start with the important one, and that is going to be the parvoviridae. Now, I think you already know a story about parvoviridae from general virology chapter, and I gave you the story of Paro and Devdas, isn't it? So did not I tell you that this virus is always like crying like Paro? Why so? Because this has the smallest size. This is the smallest virus. If you remember, it was only measuring 20 nanometers. Also, this is the only DNA virus which is single-stranded. Remember, all the other DNA viruses were double-stranded. So, this Paro from Devdas is basically very sad and she's crying because not only is she the smallest, but she's also left alone. She's single-stranded. What is the symmetry? Now, there is no difference in that because all the DNA viruses, they have an icosahedral symmetry, which was the only DNA virus which had a complex symmetry. So, pox had complex. Otherwise, all of them have icosahedral. Now, we'll come to the spread. How does parvovirus spread? So remember, it is primarily going to be by the respiratory route and droplets, but can it also spread via blood products and from the mother to child? Yes, it is possible. So blood products also mean any organ transplantation? Yes. In fact, in our country, parvovirus B19 infection is not done in the blood banks because it's not very prevalent here. But in the foreign countries, in a blood bank, while giving blood from a donor to a recipient, parvovirus B19 infections are tested for. Similarly, mother to child transmission is also known. So now let me ask you that when parvovirus is going to go into any person, baby or adult, which is that one target that it has? So remember, parvovirus, can I say PAR? Parvovirus will attack the P antigen of the red blood cell. That is how I have learnt it. So repeating once again, it will attack the P antigen on the red blood cell precursors. Guys, where are the red blood cell precursors present? So red blood cell precursors are there in the bone marrow, isn't it? So please remember that parvovirus goes into P antigen of the red blood cell. Let me tell you, it has a total of 3 genotypes and 1 serotype. So serotype to 1 hai, to just one of it. Genotypes are 3. This means genotypes are going to be parvoviridae 1, 2 and 3, out of which the most common in the world that you have is the first one. So I realize overall first important hai. Genotype maybe first is important. Serotype is there only one, right? Now let's move on to, okay, it has attacked the red blood cell precursors. That must be one part of it. But what all other things, whether it is a baby or an adult, that it can cause? Which is the one that I'm talking about? In the parvoviridae family, we always focus on parvovirus B19, and I think everyone knows it causes that slabbed cheek appearance, which is very, very famous. What is that known as? The erythema infectiosum, or the 5th disease, or the slabbed cheek appearance. Let me show that to you. This is a case of erythema infectiosum, or the 5th disease, or the slabbed cheek appearance. You can see that there is a rash present on the cheeks like this, right? So that's why I called it erythema, because there is an erythematous rash that is present on the cheeks, macular erythematous rash on the cheeks, and a thin lacy rash on the rest of the body. So the rest of the body also has a rash, but it's not erythematous. Now tell me something, that what is the, if I say what are the treatment protocols, in most of the cases this is going to be a self-limiting kind of a condition in children. It is a self-limiting rash, but it can't only be rash, because it's a viral infection. So can I say that there is gonna be a prodrome of something like fever and sore throat? Of course. So pehle the child is gonna have all of these fever, sore throat thing, and then it is gonna have this rash which is present, that is on the slapped cheek. So that is how I have learned that to slap someone you need 5 fingers. That is how 5 fingers will get imprinted on the cheek. So 5th disease is gonna be used as a slapped cheek appearance. Okay. What what else? I'll show you one more picture. So this one I'm clear, it is a slab cheek appearance, but I can also see that there is involvement of similarly the hands and the feet. So can I say this is looking like gloves and socks, as if the child is wearing gloves and socks. So the next thing that we have to know over here is the famous gloves and socks syndrome. Okay, recently there has been a question in the NEET and the INI CET, and that is they're saying that can something like this happen in adults also? It's not just children. Yes, and adults may the same hands and feet, but thoda sa complicated name they have given. They have called it PPGSS. What is PPGSS? So you will say this much I know. Gloves and socks syndrome I already knew because you had told me earlier. But what have they added? Papular purpuric gloves and socks syndrome. So that's just making things confusing. So they gave you a question where you had to match the following. PPGSS was written. Students got a little confused. So just does parvovirus called PPGSS? Yes. Papular purpuric gloves and socks syndrome. So now when you're talking about hands and feet, let's also talk about the joints. Can it involve the joints, arthralgia, arthritis? Yes, that is very much known. So take care. A lot of skin I've spoken about, a lot of joints I've spoken about. But the main thing I told you was it was going to the P antigen in the red blood cell precursors, the bone marrow. So what does it cause in the bone marrow? Two very famous things. I have taught you this a lot in pathology. Any hemolytic anemia, example a case of hereditary spherocytosis or sickle cell anemia, can that suddenly say that bone marrow will shut off? Suddenly in this hemolytic anemia, bone marrow says, I'm not going to do any work. Why? If the bone marrow has entered into aplastic crisis, that is always seen in response to parvovirus. So I want to take you back, guys, into your pathology, because whenever you were talking about these hemolytic anemias, you had two types of crisis that we had to refer to. One of them was the aplastic crisis. Whenever in a hemolytic anemia, you have an aplastic crisis, you will always think of only one infection, and that is parvovirus B19. However, if they ask you, there is a hemolytic crisis that has happened. Suddenly everything has started breaking down. All red blood cells have started breaking down. What was that? That was associated with Epstein-Barr virus. These two questions you have already done in your pathology. Please integrate it. At least I can do this much of integrating two subjects for you. So going forward, aplastic crisis is going to be by parvovirus B19. However, aplastic crisis means everything has shut off. The bone marrow have just given up. RBC, WBC, platelet, kuch bhi nahi banayega. On the other hand, its primary target was red blood cells. So can there be something called only red blood cell production stopping? Pure red cell aplasia. Yes, PRCA is also possible. Pure red cell aplasia. I want to make another dabba. So this is going to be quite a nice dabba wala slide over here, but it's good that we correlate. Let's correlate this with a little bit of medicine and surgery. Whenever they write pure red cell aplasia, either they are talking about an infection, which we have done over here, parvovirus B19. Maybe they are also talking about a tumor. Has this been associated with thymoma? Yes, pure red cell aplasia. I've taught you this in the neoplasia chapter of path. You studied this in surgery and medicine. Thymoma patients can have PRCA. Okay, this is what patients have. What if it's a mother to child thing? What is the child going to have? There is going to be hydrops fetalis, because I said it is transplacental. That's the entire spectrum of things that you're going to notice. How are you going to do the diagnosis? Of course, for antibody testing, we always do ELISA, and it is a DNA virus. I will do a polymerase chain reaction. There is nothing very fancy about it. So sorted. Before I move on to the next virus, I want to do a quick recap. What are these first, second, third, fourth, fifth, sixth disease? Right now, what did I study? Fifth disease, ma'am, 5 fingers is what you need to slap someone. So this is going to be the slabbed cheek appearance, which you can also call as erythema infectiosum. Erythema infectiosum, slabbed cheek appearance. Okay. You have also studied the 6th disease in the previous chapter only. Human herpes virus 6 was causing the 6th disease. What was that? Roseola infantum. Roseola infantum was the 6th disease. So HHV 6 causes 6th disease, whereas the 5th disease is the 5 hands wala slap. Now let's move on to the other. The 4th disease is something which is obsolete. It had 4 letters, the Duke's disease, but it is now obsolete, so I really don't have to worry about it. S for S, second disease is scarlet fever. Second disease is scarlet fever. So what are we left with? The first and the third disease. Please note, the first disease is referred to as measles, and the third disease then becomes German measles. How easy is that, right? So let's do a quick recap. The first disease is measles. The third disease is going to be German measles. The second is going to be scarlet fever. The fourth is 4 alphabets Duke, which is obsolete. Fifth is 5-handed slap, that is 5-fingered slap, that is flat cheek appearance. And sixth is HHV6, that is roseola infantum. Before I finish this, let's integrate to the next level. Another slide of pathology that I've got for you. What is this cell? If you remember in pathology, I taught you in your hematology chapter, these are going to be red blood cell precursors which are showing you ears like a dog coming out. These are red blood cell precursors with dog ear projections, and this was also associated with parvovirus B19 infection. And now I can give you the final mnemonic. Number one, the P, A and R had told us that it is going to attack the P antigen of the red blood cells. After that, now we can say the parvovirus is going to show me P for projections. It's going to show me P for projections, and you can see the dog ear projections that you are having over here. Finally, because you are referring this as paro, you can say that this is going to be the smallest in size, and this is going to be a single-stranded DNA virus. That's a quick summary about it. Parvoviridae family is done. Let's move on to the next one, which is said to be the Papovaviridae family. Now, the way we say Papova, let's try and make it a little similar sounding words. We have papilloma virus and polyoma virus. I'm going to start with this chota wala family first, that is polyoma virus. What all comes under it? I can see something called Merkel cell virus come under it. Now, when we are talking about Merkel cell virus, no points for guessing that it is going to cause Merkel cell carcinoma. Am I going to integrate this again? Of course, yes. Merkel cell carcinoma, you will tell me what kind of a tumor is it, and you will also tell me what are the markers from pathology. So remember, this is a kind of a neuroendocrine tumor. This is a kind of a neuroendocrine tumor which tends to usually occur around the skin, on the skin. And if you remember, I had told you the CK7 and the 20 profile of this, and it was only and only 20 positive. It is a CK negative, C7 negative, 20 positive, only 20 positive. Okay, this is Merkel cell carcinoma, skin ka neuroendocrine tumor. The next one that comes under it is SV40. SV stands for, you don't actually have to know the full form of all of these, but some of them, yes. Simian vacuolating virus. SV40 was for a long time said to be non-pathogenic to humans, that it is not going to cause any disease to us. Yes, that is right. But now, of course, things have changed, and I'm going to integrate this further. Has this been associated now with some cancer in the lung? Yes, that could be a recent question. SV40, go back to your lung tumors. So much of integration happening here. Go back to your lung tumors. I've told you now mesothelioma is associated with SV40, long-term exposure to SV40. Okay, now we come to JC virus. JC virus is a virus that is going to go and attack the oligodendrocytes of the brain. Okay, oligodendrocytes kya banate hain? Tell me from your basic histology, anatomy, oligodendrocytes make myelin for the brain. Now, if JC virus is attacking the oligodendrocytes, this means the myelin will not get produced. And what is it going to result in? It is going to result in a demyelinating disorder. Guys, which disorder am I talking about? It is PMLE, progressive multifocal leukoencephalopathy. PMLE, that is progressive multifocal leukoencephalopathy, very commonly written as PMLE in your textbooks, and this is a demyelinating disorder. Ek aur correlation karna padega. We will have to do another kind of an integration. What is that integration? Can you tell me the stain for myelin? Myelin stain that we have studied, it is Luxol Fast Blue. What was the methodology of learning it? How will I know that Luxol Fast Blue is the stain for myelin? Because tell me, will you get a positivity over here? No. This is a demyelinating disorder. I will get a Luxol Fast Blue negativity over here. Myelin gaya, stain gaya. How did I learn it? I told you, myelin makes your conduction faster. Why is God given myelin around the brain, cord and nerves? Because it makes conduction faster. So myelin is something which is going to make things faster. faster for me. तो myelin का जो stain है, that is Luxol fast blue. However, in PMLE, because there is a demyelinating disorder, Luxol fast blue comes out to be negative. So Merkel cell virus, Merkel cell carcinoma, SV40 mesothelioma, JC virus causes PMLE. Now I take up the BK virus on the next slide, because firstly this is something having K matlab kidney. What does it cause? Yes, it causes everything to do in the kidney. It causes interstitial nephritis first and foremost. Second, it is going to cause hemorrhagic cystitis. One in the brain, one in the urinary bladder. It causes interstitial, so one in the kidney and one in the urinary bladder. So hemorrhagic cystitis and interstitial nephritis. That is going to be the BK virus, and this is usually seen in post-transplant patients. This is a very, very bad, thing that you see in how a pathologist or a microbiologist sees this on a urine sample. I'll tell you how. This is seen in post-transplant patients. So what students learn it as is BK virus, only a mnemonic, bad kidney. It is associated with a bad kidney, matlab kidney transplant ke baad, post-transplant patient. So what will you see? Whenever you see the urine microscopy in these patients, so maybe you did not have a history. Many a times in the, in hospitals, the intern doesn't write anything. Adult male and urine sample has been sent to either a pathologist or a microbiologist. When they're seeing this under the microscope, they see that urine is showing you huge cells. Can you see? There are large cells that are noted, and look at the nucleus inside it. The nucleus is almost as big as the cell. If I highlight it, it is almost as big as the cell. You will say, ma'am, large nuclear cytoplasmic ratio. High nuclear cytoplasmic ratio is what you're seeing over here. This is gonna mimic a cancer cell. You will say, oh my God, is this bladder cancer, urinary bladder cancer? No. When you call up the ward and you're like, Are, did you see any growth in the urinary bladder? And they'll be like, no, this is not a cancer patient. This is a post-transplant patient. So then you say, acha, these cells which are mimicking cancer, they are not cancer. These are actually said to be the decoy cells. These are said to be the decoy cells that, oh, they are trying to be deceptive. They're trying to trick me. They're not cancer cells. They are BK, bad kidney virus ki wajah se these cells are formed. So that becomes your entire polyoma virus family, right? Polyoma ke baad, what is the next thing that we have to go to? Papilloma. Papilloma means what? That is the human papilloma virus. We all know, a lot about it already from our general knowledge. It is going to be the human papilloma virus. Remember, it is non-cultivable and it is non-enveloped. Do you remember PAP mnemonic type? Yes, of the non-enveloped virus. In that you had the papilloma virus which was non-enveloped. I will be revising that in a while also, because now going forward, I hope you remember PAP and PARCH. Kuch yaad hai, nahi yaad hai, please go quickly back to the general virology. That's a golden chapter. You have to know it. So this is going to be non-cultivable and non-enveloped. Now this means that now I have to know the diseases. Lots of strains are there. So for simplification, what I've done, human papilloma virus can either involve the skin related things or the mucosa related things. So when it's involving skin, I have divided them into low risk and high risk. When it's involving the mucosa, I have again divided it into low risk and high risk. Okay? So when I talk about the skin, the low risk ones are chota numbers 1, 2, 3, and little bigger numbers if you have, they are going to be 5 and 8. Okay? 1, 2, 3, 5 and 8. So let's see. Cutaneous involvement 1, 2, 3. So क्या हो सकता है? Can you see this kind of a wart over here? Yes, because that's occurring on the foot. Can I call it a plantar wart? And the same picture comes. They will show you a man with this kind of a plantar wart, and they will say, okay, what is the implicated virus? So wart related, anything that is related to wart, or what is the other term for wart in dermatology? It is also known as verruca. So remember the plantar wart. After that, I can see something over here. This is on the eyelid, of course, but this has those papillary kind of projections, right? What is this known as, guys? This is the filiform wart. This is the filiform wart. This is also associated with all these HPV 1, 2 and 3. Very, very famous. What happens with human papilloma virus 5 and 8? Have you heard about it? 5 and 8 say kuch hota hai, and you must have seen this very, very, classical picture on a lot of places on social media also. With HPV 5 and 8, we have this man has so many warts that he starts looking like a tree. This is known as the tree bark appearance or the tree man syndrome. Achha, now that I said tree bark, before I proceed, all of you have to tell me something. Where do you see the tree bark appearance? Tree bark aorta. Okay, I'll put it up directly. Tree bark aorta is seen in 3, 4, 3. It was seen in tertiary syphilis. tertiary syphilis. Remember, I've taught you under bacteriology in syphilis. I've also taught you in the aorta chapter of blood vessels in path. दो जगह पढ़ा है. So this is the last time. Tree bark appearance is going to be seen in tertiary syphilis. This is tree man syndrome. Tree man basically means that you have this multiple warts, and that is now known as epidermodysplasia verruciformis. Verruca matlab wart. So epidermodysplasia verruciformis is because of HPV 5 and 8. This has also been associated with chromosome 17 defect. So this is also a chromosomal problem. So HPV 5 and 8 bhi ho gaya. So 1, 2, 3 were causing all these plantar, filiform, all these warts. I'll make a labeling over here, and HPV 5 and 8, I'll make a tree over here so that you remember it is going to cause the tree man syndrome. Now let's go to mucosal involvements. Mucosa. So now please note that the low risk ones are again chota numbers, 6 and 11. What do they cause? They again cause warts. But this time, what kind of warts do they cause? I can see something in the respiration tract, vocal cord. ये दिख रहा है vocal cord के पास there are warts. Yes, and I can see something related to the genitals also over here. So firstly, this is going to result in laryngeal papillomatosis. This is larynx. Larynx matlab mucosa. Now don't think about skin. Don't think about palmer, plantar, tree man and all that. Go into mucosa. So think of the larynx. Laryngeal papillomatosis. Laryngeal papillomatosis. So is this patient obviously going to show you probably a voice change? Of course, vocal cord pe ho raha hai, so there is going to be an element of voice change present. What else? I can see genital. Of course, there is genital. What is that known as? What is the clinical term of genital warts? Condylomata acuminatum. Condylomata acuminatum is what you are seeing in the form of genital warts, right? So condylomata acuminatum, because now I'm going to ask you, where did I teach you condylomata lata? Condylomata lata was what, if you remember? What were these? These were also mucocutaneous junction pe something, but they were seen in what? They were seen in secondary syphilis. I'm going to change it because over there I gave you a mnemonic. I used to call it condylomatu so that you could remember that you are seeing it in 2, secondary syphilis. That was condylomata lata or condylomatu for, and we had learnt it occurs at the muco-Q2 junction. Mucocutaneous junction pe jo nodules the, those were condylomatu muco-Q2 syphilis. 2 to 2 we had done. Yaad aa gaya? Here I am talking about condylomata acuminatum, which is the word given for genital warts. Till the time it is what? Whether in the larynx or in the genital, wart matlab low risk, matlab chota number 6 and 11. But as soon as it goes on to bigger numbers, especially 16, 18, and then of course 31, 33, 35, even 40s and 50s, these are the ones which are extremely difficult because now they are going to result in squamous cell carcinoma. Which cancer did I say? Squamous cell carcinoma. Why? Because this HPV attacks the squamous epithelium. Now you will think of all the places in the body where a squamous epithelium is present, which I'll come to. But ye photo dekho, can you see another picture of, now let's take a test. You are seeing some genital warts, matlab what? Condylomata acuminatum. Now tell me, genital matlab mucosa. And mucosa ka warts hai, so then we are going to think of 6 and 11. Agar ye skin wala warts hota, maybe for example, if this is the palms and the soles, okay? If this would have been skin, you would have thought of other numbers like 1, 2, 3. वो वाले numbers होते, ठीक है? Now let's move on to why and how is it causing all of this. This is the structure, and this question has almost made a hat trick in the papers. It's being asked every year. So please remember, this is the structure of the human papilloma virus, where I can see the beginning, that is the L1, L2. What I have to know, one word I'll tell you about everything. L1. So please remember, the L1 capsid protein is what is being used for preparing the vaccine. This was a question which has almost hit a hat trick now. Which part of HPV is used for making a vaccine? It is L1. Then they said that there is something called E2. What is E2 going to do? E2 is basically the controller. E2 is the controller till the time E2 is like the principal of the school. Till the time E2 is there, very strict, no one else. No one else over here, E6, E7, E4, E5, no one is allowed to work. The principal will be like, keep quiet and sit. However, when this enters into our body, the controller is gone. E2 is just somehow gonna vanish out. So now these rest of the people are gonna have a party. So what are they gonna have a party for? Let us start with the next numbers, E4 and E5. Please note the next numbers, that is E4 and E5, especially E4, is responsible for making a change in the cell called coelocytosis. What is coelocytosis? Let me show you a picture. This is a coelocyte. First, let me describe it. So you will see a cell like this. ठीक है, एक cell होगा, and inside the cell you will see a very dark, I've made special, almost black color I have made, right? So that kind of a nucleus is known as a racenoid nucleus. You're gonna see a racenoid nucleus, and did you also see around the nucleus I've not made the cytoplasm. Around it I've kept it khali. This area I've kept it khali because this is known as the perinuclear halo. So please remember there is a racenoid. Everyone knows na raisin is kishmish, dry fruit. So racenoid nucleus with the perinuclear halo. So I've got you two pictures. This is a pap smear and this is a biopsy. ठीक है, we all know pap smear of the cervix is a screening technique. Biopsy is going to be a confirmatory technique. However, both of them show you the same coelocyte cell. So if you look at it, what do you see in the nucleus? Ma'am, the nucleus is definitely looking a little dark and the area around the nucleus is a little lighter. ये pap smear पे देखा. Compare, you can compare. This is a beautiful picture because I've got you comparison of normal. देखो normal nucleus is so छोटा छोटा. This one is so big and dirty and the area around it is white. So this is definitely gonna be a coelocyte. Look at the same thing on a biopsy. You will see the same thing, guys. Have a look at it. You can see that, yeah, the nucleus is looking very, very shriveled and dark like a kishmish, like a raisin. And there's a whitish area around it. You will see this all over. Dark nucleus with white area. Dark nucleus with white area. This is basically a racenoid nucleus and perinuclear halo known as coelocyte. Who made it? E4 and E5 made it. Now, what are we left with? We are left with E6 and E7. Now, these are the deadly ones. Now, please note, which are the molecules which are responsible for cancer formation, carcinogenesis, and that is going to be E6 and E7. How do they cause cancer? Very famous question. E6 is going to go and inactivate the policeman. Who is the policeman? P53. E7 is going to go and inactivate the governor of the genome, that is RB gene. Can you remember this from path? Yes, that we had done. Policeman is a junior official, governor is of course senior most. So for the junior person you have the junior number and for the senior person you have the senior number. So policeman ke liye you have E6 and governor ke liye you're gonna have E7. So I'll write their names so that you remember the mnemonic. P53 is policeman, RB gene is governor of the genome. So cancers ho gaye. So now exactly my point. What cancers are you talking about? Whenever they cause cancers or carcinogenesis, I told you it will attack which epithelium? Squamous epithelium. So think of areas that have squamous epithelium. Cervix has squamous epithelium, so cervical cancer. Males mein bolo, to penile has squamous epithelium, penile cancer. Both males and females have, squamous epithelium in anal canal. So anal canal cancer is also possible. But why am I only talking about the genital area? Squamous epithelium is also present in the oral cavity. Oral cancer, it's also present in the vocal cord, larynx. This can cause laryngeal cancers. It is also present in the esophagus. So this can also be associated with esophageal cancer. So the concept is wherever there is a squamous epithelium, it carries a risk of being attacked by human papilloma virus. I hope everyone's okay because now once you've done this, very important 4 points. Jaldi se revise. What is L1 used for? Viral vaccination. What is E2? The controller. What are E4 and E5? The ones which make coelocyte. And what is E6 and E7? The ones which are responsible for cancer formation. How do you do the diagnosis? I've already told you that the screening modality was pap smear and confirmation karna hai, so you do a biopsy. On either of the two, what shall you be seeing? You shall be seeing the presence of a coelocyte. But I think it's a DNA virus, तो कुछ DNA, PCR, do some kind of genetic analysis, yes, do some molecular tests like PCR, and nowadays there's a very famous test called HCA, that is hybrid capture assay. If you see this written anywhere, they are wanting to test for human papilloma virus, that is hybrid capture assay. Finally, I was talking so much about the vaccine, so of course I'll quickly touch upon the vaccine, but I quickly want to ask you guys, tell me something. Vaccine ke liye what was used? The L1 capsid was used. Please, if I start integrating so much, I believe that the course will never end, but this is almost a half an hour topic that you have to cover from gynecology. What are the indications, the contraindications, what is the age group, what are the dosage, what are the recent guidelines. In fact, even till yesterday I have read something new about HPV. So vaccine is all time growing, and gynae may please do follow it up like till the end. So what are the vaccines? I'll give you obviously a quick overview. Cervarix, Gardasil and Gardasil 9. So pehle Cervarix is a bivalent vaccine. Bivalent vaccine means it is going to protect against two strains. So it's going to protect against the which ones? Protections are going to be against HPV 16 and 18 because they were the ones which were causing cancer. But Gardasil said that I want protection against the low risk ones also. The Warts wala also. So 6, 11, 16 and 18, all four are given protection against. But now they've come up with a nonavalent vaccine which gives you protection against 9 strains, and that is going to be Gardasil 9. So please remember, firstly, Gardasil is like a guard. The main 4 things are covered. 6, 11, 16, 18, because 6, 11 cause warts, 16, 18 cause cancers. So the main 4 are covered by Gardasil. Cervarix is a chota version that is only going to protect against the main 16, 18. And Gardasil 9, of course, is nonavalent. The name only tells us. So human papilloma virus almost finished, and like I told you, I'll give you a little bit of details about gynae. So please remember something about this Cervarix vaccine. This has an adjuvant. Firstly, go back to your basics of immunology and read what is an adjuvant. Adjuvant is a molecule that is added into a vaccine so that you can enhance the immunity. This is basically going to go and act on the toll-like receptors and is going to basically enhance or incite the immune response or the immunity. So ये adjuvant क्या होता है? You just need to know ASO4 is a system. It's a system of adjuvants, and that is added into this Cervarix vaccine so that the immune response can be greater. That wraps up definitely our Papoviridae, including polyoma and papilloma. The entire family is done. Now let's move on to the next, and that is going to be the Poxviridae family. Under the happy mnemonic, let's continue with the Poxviridae family. These are the points which you guys already know about pox, so very quick recap. What is the size? We all remember it's the largest that we have, which is measuring somewhere around 300 nanometers. Do you remember the shape? I gave you a mnemonic. Pox is a box. Pox is a box means it's going to look like a box or a brick-shaped virus. And inside the brick, why is the brick so heavy and big in size? Because you have a dumbbell inside it. It has a dumbbell DNA core. It has a dumbbell DNA core that is going to be present. Okay, what about its symmetry? I told you all the DNA viruses, they are going to have an icosahedral symmetry, isn't it? But remember, we had studied one mnemonic, pox is everything complex except pox virus, because pox was complex. This means it was having a complex symmetry. What is your mnemonic? Pox is complex. So it's going to have a complex symmetry. Finally, the replication. Again, we have a rule. All the DNA viruses are going to replicate in the nucleus. But pox virus is again an exception, because pox virus is going to replicate in the cytoplasm. So all in all, I realized pox is just a box also, but it's out of the box. It's very different. It's the largest. It's a box or a brick with the DNA that is dumbbell shaped. It is complex symmetry. It's replicating in the cytoplasm. Everything is going a little different. What are the different pox viruses that you need to know, guys? We have the very, very famous vaccinia and variola. Vaccinia and variola are known as cowpox and smallpox respectively. Then we have molluscum contagiosum, which is also a pox, and we have something which was there earlier, but now you started seeing a few cases in the news also, monkeypox. So let's get going. Let's start with smallpox first. Smallpox is variola, which has an incubation period of roughly 10 to 12 days. However, we know that smallpox has been eradicated. Firstly, what all was there that led to its eradication? The clinical features. There were very, very classical clinical features which was easy to pick up. How am I going to learn the clinical features? I shall be correlating smallpox versus chickenpox. Chickenpox you guys have read. Tell me. Chickenpox. Does the rash come in crops? Yes. The rash is going to come in crops and there's going to be fever with each crop. There is going to be fever with each crop. So rash comes in certain crops, one crop and then after another day another crop. Every time a crop comes, fever is gonna come. In smallpox, there is no cropping phenomenon seen and there is no fever with every crop that is going to see. Further, the most important part is the distribution. So we had learned CP mein CP means that the initial part of chickenpox is going to be centripetal. Centripetal means it is going to start on the trunk. So starting is centripetal and after the trunk it will go on outside to our extremities. So the spread is going to be centrifugal. The spread is then going to be centrifugal. So remember CP mein CP. CP mein chickenpox mein the starting is going to be CP and that is going to be centripetal. Then it will go out, whereas smallpox mein ulta. The starting is going to be centrifugal. It's going to be on the out, centrifugal distribution, and later on it can come into centripetal. So that is the spread that will happen. So you know now starting CP mein CP karna and smallpox mein opposite. In fact, like I told you that there is no crops, and when I say fever is not there, doesn't mean patients don't have fever. Patient have fever, but it has no relation with the crop. So what I can say is that fever subsides with the rash. Fever is going to subside with the rash that is going to be there, right? So but fever hota hai, but once the rash comes, the fever goes away. Okay, so the reason was that there were such typical clinical features that I could pick up the patients very, very easily. The patients were not being missed out. Secondly, there was no animal reservoir, there was no carrier. In humans also, there was no one carrying it, there was no animal reservoir. So once it got eliminated, there was no chance of coming back. And finally, of course, we had a vaccine. So what vaccine was there? And you know a lot about its vaccine in terms of the historical aspect. So remember, in 1980, there was an eradication program by WHO in which they did all these points and they had a vaccine. So the first vaccine that was prepared, I hope you remember, who made this first vaccine? It was made by Sir Edward Jenner. Go back to your first chapter of micro and I've taught you. Sir Edward Jenner made it using what? Smallpox vaccine was made using cowpox. Using cowpox. Cowpox is what? Cowpox is vaccinia. So remember the variola ka vaccine was made using the vaccinia, that is cowpox, and this is a live vaccine, right? So the vaccinia vaccine tha was a freeze-dried preparation of a live vaccine. So this is what Sir Edward Jenner had done for us. Almost over with it. Smallpox is done. Similarly, you will say, ma'am, variola, so you have taught us. It has also been eradicated also. What is this cowpox? So obviously, this is something that you see in cows, but can it come to humans also? Yes, it can. So please remember that vaccinia, I'm going to tell you the mnemonic. Vaccinia is the cowpox and variola is going to be the smallpox. No confusion. Vaccinia CC is going to be the cowpox. What am I telling you? There were some bodies which I told you in the first chapter. One of them had Paston, one of them had Guarneri. So we had studied the way you write vaccinia. So ek C se to pata lag gaya that it is a cowpox. Other C, I'm going to change it into a G because what you see is the Guarneri bodies. What you see over here are the G for Guarneri bodies. Whereas where do you see the Paston bodies? Paston bodies are seen in smallpox. After that, you wanted to grow it. Now, where do you grow it? I have told you. Think in general micro, in general virology only I have told you. Chorioallantoic membrane. Revise with me, please. When I say revision, what all is grown on CAM? Chorioallantoic membrane. Remember embryonated egg. So I had told you, you had HHVV. What was HHVV? Herpes simplex 1 and 2. So HH, herpes, and then you had VV, that is for vaccinia and variola. They are grown on the chorioallantoic membrane. So cowpox wala is going to show you hemorrhagic lesions, and smallpox, small hai, so it's going to show you small non-hemorrhagic lesions. So the names are only telling me. Small is going to show you small non-hemorrhagic lesions. Cowpox is going to show you hemorrhagic lesions, and these lesions over here, they are also known as pox. Please remember the lesion, not the pox wala POX. No, the lesions over here are known as पॉक लीजन्स, ठीक है, तो सिंपल पॉक्स में क्या बनता है, पॉक लीजन बनता है ऑन द कोरियोएलेंटोइक मेम्ब्रेन. स्मॉल पॉक्स डन, काउ पॉक्स डन. नाउ I go on to the dermatology favorite molluscum contagiosum. What is it caused by? It is caused by the molluscum contagiosum virus. There are many forms, 1, 2, 3, 4. Mainly 1 and 2 are in circulation more, and 1 is the most common one that you notice. So molluscum contagiosum virus. Please don't get confused in the exam. Molluscum contagiosum virus is what I'm talking about here. And Merkel cell virus I had spoken about previously in the polyoma family. वो Merkel cell carcinoma करता है, ठीक है? Abbreviations are very similar. Okay, so first and foremost, how does someone contract this infection? This is primarily by contact. It is a contact based, by coming in contact. That could be skin to skin contact, that could rarely be even genital contact. So very much possible. I'll tell you a lot of cases which I once saw during my internship. In my internship, I saw in the dermatology, although we don't really do much of dermatology in internship as interns. But yeah, when we had that short posting, I remember we saw a lot of females who were coming with molluscum contagiosum lesions around the eyebrows and the upper lip and the chin and face area basically. So we were wondering that what is this sudden that it has started coming more on the face. And then we were reading up about it, because as interns you're a little more curious and you rarely get time away from making all the discharge sheets and collecting blood. Very rarely do you get to read up on patients. So this is also something, if you read up in journals, associated in contact through the thread that is used in parlors. So for women, the thread that was being used for removing the hair in the facial hair, that thread was acting as a source of contact from person to person. And yes, that was another study that we had studied. Just wanted to share with you because this needs a lot of caution amongst women, at least. You guys, girls should always be very cautious about where are you getting anything done from. So contact is one mode of spreading molluscum, but it can occur all over the body, except these rashes or lesions will be seen all over the body except palms and sole. Who is the reservoir? Only humans are the reservoirs. ठीक है, तो this was about its epidemiology. What is this lesion that I'm seeing over here? Beautiful lesion. Beautiful for us, not for the patient. So this is what? This is a tan-colored umbilicated lesion. This word is very important. This is a tan-colored umbilicated lesion. What do I mean by umbilicated? If you look very carefully, do you notice there is a depression in the center? Depression, crater in the center. Look here also, there is a depression or a crater in the center. So that is an umbilicated lesion that you have. And if you press on it, there is a curdy discharge that is going to come out. So every time you get a molluscum lesion, you press on it, some whitish material comes out. Okay, so what do we do? Biopsy karte hain. Let us look at this under the microscope. Let us do some skin scraping. What do I see in molluscum contagiosum? The lesion is classically coming out as a cup-shaped lesion. It is a cup-shaped lesion, and if I zoom into the cup will have something inside it. So kya hai cup ke andar? I can see some bodies. What were they known as? I have taught you under general viro, so you won't spend much time. These are known as the Henderson-Patterson bodies. These are referred to as the Henderson-Patterson bodies, which are abbreviated very famously as the HP bodies. And we have to study that these HP bodies are going to be stained by something known as the P for Paneth. So we need to know what is the stain for these Henderson-Patterson bodies, which is a very famous dermatology question also. Please note there is a stain called the floxine tartarate stain. Floxine tartarate, if it's written as tartrazine, it's the same thing. Floxine tartarate stain. And this is used for two things, one in path, one in micro. So micro ka to we have done. The HP bodies is what it is used for. But in pathology, have you all heard of a cell called the Paneth cell? Where is the Paneth cell present? It's present in the GIT. So please remember, the P for the floxine tartarate stain is used for staining the P for the HP bodies and the P for the Paneth cells, right? Now, this is what you've seen, molluscum ho gaya, but I want all of you to revise. Where did you see the Halbersteder-Prowaski bodies? Where did we see the Halbersteder-Prowaski? Because guys, that is also abbreviated as HP only, but the disease is totally different. That is seen in trachoma. So remember, Prowaski wala body is seen in trachoma, Prowaski wala body is seen in trachoma, and then Henderson-Patterson bodies are seen in molluscum contagiosum. Those two HP are different. ठीक है. Now what else? In molluscum, are you only going to do skin scrapings? No, of course. This is a DNA virus. तो polymerase chain reaction तो करोगे for DNA, and you know that this is a pox virus. Pox virus basically means that it's going to look like what? It's going to look like a brick box and a box with a dumbbell. So I will do electron microscopy, and this is non-cultivable. Which other virus did I teach you that was non-cultivable? Even the human papilloma virus, and now pox में this molluscum contagiosum virus, these are coming across as non-cultivable. ये भी हो गया. What is the last pox virus that I have to know of? All of you have seen this in the news of lately also in 2022 and 23, and earlier also many decades there was monkeypox, which of course comes from the monkeys. But who is the reservoir? So primarily animals में होता है, and typically rodents are said to be the reservoirs. Rodents are said to be the reservoir. How is it gonna come to us? Of course, anything related to animals. So zoonotic हो गया ना. This is gonna be by bites and scratches and consumption of meat. So these are the different. अब animal related तो हमेशा the mode of transmission is always gonna be this. Can there be a human to human transmission possible? Yes. Human to human transmission is also known. That is why when it came in the news, and it came just after COVID, so everyone had a major hype about it. Okay, what is the incubation period? The incubation period is roughly 2 weeks. In terms of clinical features, it's like any other pox virus. Matlab, it's going to cause fever, it's going to cause rash. But what is different over here, which I did not study anywhere else, is that this shows you lymphadenopathy. So remember, monkey, langur में lymph node मिलेगा. ठीक है. So remember, not in the others, but in the langur you are going to find lymphadenopathy, not in the other pox viruses. ठीक है. Now we say, how will you do the diagnosis? So when there is a rash present, you will always take skin scrapings. Fine, I'll take a skin scraping. What will I do with that skin scraping? I know for a fact that this is what? DNA virus family. So what can I do? I can do a PCR from that and find it out. That is what you had to know about monkeypox. So the entire pox is done. Vaccinia, variola, molluscum, monkeypox. Now coming to the last one in this happy mnemonic, and that is adenovirus. And you already know, I told you adeno looked like what? Adeno looked like a alien. So alien kahan aayega? Alien is going to come in a space vehicle. What is the shape of this? This is going to be the space vehicle shaped one, and I can see that there are some projections coming out of it na. So those are said to be fibers. There are some projections. So the alien also has to land, the spaceship also has to land. So from the surface we see there are some fibers coming out, and these will later on help in attachment. They will help in landing on our body cells. So remember, this is an alien wala space vehicle shape with some projections for landing, and those are known as the fibers. Okay, this is non-enveloped. I had already told you pap wala mnemonic chal raha hai. So remember, the papilloma virus was non-enveloped. Now the adenovirus is also non-enveloped. Everyone knows that mnemonic. Good. Of the last part of adenovirus is what students run away from this, the maximally, because these are all the diseases. ठीक है ma'am, रट लेंगे. The problem is that in this entire thing, now I'm going to tell you a lot of numbers. Ma'am, ye we cannot do. So let's do one by one. Look at this. When I say hemorrhagic cystitis, this goes in the urinary bladder. So hemorrhagic, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Hemorrhagic has 11 alphabets, which is the strain of adenovirus that causes it commonly. 11 and 21. So sabse pehla yaad ho gaya. Hemorrhagic is 11. Next one, infant diarrhea. Diarrhea can be, sorry for using these words, but diarrhea is known as potty. So potty reminds me of 40. So which are the strains which are going to cause infant diarrhea? 40 and 41. This is everyone's favorite. You will never ever forget it. Now let's come to the eyes ka problem. There are two very famous problems that you have. First, let me tell you the meaning. Kya kya likha hai? We have written something called pharyngoconjunctival fever called swimming pool conjunctivitis, and epidemic keratoconjunctivitis known as shipyard eye. So what all is written over here? Let me sort out that first. Swimming pool conjunctivitis. So there is going to be a history of swimming that is going to be there. It is known as pharyngoconjunctivitis. Pharyngo means the patient is going to have pharyngitis. And conjunctivitis, of course, so this is usually a type of a follicular conjunctivitis, which can be unilateral or bilateral. So remember, pharyngitis, follicular conjunctivitis, history of swimming pool, that is pharyngoconjunctival fever, usually seen in children. Next we come to the another one. Shipyard eye kya hai? Epidemic, ship पर एक epidemic हो गया, everyone has had this. So ship पर epidemic means this is definitely gonna work as an epidemic. And I can see the conjunctivitis word is there. So again, there is a follicular conjunctivitis. Kerato word is there. So maybe there are some corneal opacities also that I can think of. Corneal opacities can also occur. So if you know the words, you know everything. Na? Epidemic, cornea, conjunctiva, known as shipyard disease. Pharyngo, conjunctiva, swimming pool conjunctivitis, as easy as that. Something that is going to be there in both of them, and see at the end of the day, dono mein hai to some kind of an infection. So can there be a preauricular lymphadenopathy present in both? Preauricular lymph node in both. Now let's come back. When I'm talking about the shipyard eye, so pehle draw one spectacles like this. Eye kya bana? This is 8 का shape में बना ना, तो you have to continue from 8. It is 8, 19. ये दोनों तो please learn. 8, 19, even 37. But 8 and 19 you have to know, and I will know that okay, shipyard eye, you are learning it as 8, right? Shipyard eye, you will make an eye like this and you will learn it as 8. Now we come to pharyngoconjunctival or swimming pool conjunctivitis. Eye to ye bhi hai, but swimming pool. Have you ever see, most of the people learn how to swim on their own only, but there are some people who take swimming lessons. So if you've ever gone in for swimming lessons with a professional coach, first 3 days the coach always tells you sirf float karo. First 3 days only float. Then by 1 week he will teach you some strokes. And by 2 weeks, he will say, he will teach you and he will now leave you on your own. So what are the 3 phases in your entire thing? Please note, on day 3, he will say flotation seekh lo. On day 7, 1 week pe he will teach you some basic strokes, and on second week he will say you are fully trained. So 3, 7 and 14 in the swimming pool is how you're going to learn swimming and how you're going to deal with this. These were the eye related stuff. Now we move on to the respiratory. I told you na, pharyngitis to pehle bhi pada tha. Yes, this is one of the most common causes of pharyngitis that you have, which people believe is strep pneumoniae, but this is one of the viral causes of pharyngitis that you have to know. So it causes upper respiratory tract infection. It causes pneumonia also, lower wala also. So how will we learn it? 1, 2, 3. Upper ke liye, we can't learn all. So we learn the ones that can easily be learned. Upper ke liye 1, 2, 3, and lower ke liye 3 se continue karo. 3, 7, 21. So what did I say? For upper respiratory tract 1, 2, 3, and for lower, that is pneumonia, start from 3, 3, 7 and 21. Now we come to transplant recipients, people who have received some kind of a transplant. So remember, trans for 30. Trans for 30. So जो 30 वाले strains होंगे, 34, 35. So remember, transplant patient 30 वाले strains में जाएगा. जल्दी से repeat because that's the end. Hemorrhagic cystitis, 11 alphabets, 11 strain. Infantile diarrhea, you'll never forget, 40, 40, 41. Epidemic keratoconjunctivitis or shipyard eye, तो 8 and 19. Swimming pool, 3, 7 and 14. Upper respiratory tract infection 1, 2, 3, and then lower 3, 7, 21. Transplant में 30s, and that is the entire summary of the adenovirus, which also makes you wrap up the entire happy mnemonic. Now I'm going to move forward and talk about this H that was missing, that was hepatitis, because which virus comes under DNA families? Hepatitis B, and all the others come under RNA. तो एक combine कर ले, transition between DNA RNA. Let me teach you hepatitis B from DNA, and let me teach you all the other hepatitis from RNA, so that hepatitis can become one chapter, and I've integrated this chapter from path also. So all the pathology images are also included in this.